We didn't have anything to pick up on from previous group. When I was practicing, and it was very haphazard practice, the exam is like 4 months away. It's still not sinking in what you have to do. You start having brain fog. You start doubting.
What happened afterwards when the result was out?
The day the results came out, I was very grateful for everybody, especially my mom. The coaching that you provided, a lot of the information that you had signposted. I was very, very, very grateful for that.
Are you struggling with the SCA exam? Maybe you feel you don't know how to start your preparation, or that you're completely lost. In this video, I'm going to show you how a GP trainee overcame this anxiety and managed to pass her exam first attempt. My guest today is Dr Yoginee who recently passed the SCA first attempt. Hi Yoginee, how are you doing?
Hi Erwin, I'm doing very good, thank you. And I hope you're well too.
Yeah, good. Congratulations on passing your exam. And thank you for coming to share your experience with us today.
Oh, thank you, Erwin. I'm very grateful to have this opportunity because I think a lot of people might identify with a few of the things that we go through as trainees.
Absolutely. So for some people who might not know you, could you introduce yourself, please?
I'm Yoginee. I'm a GPST 3. I'm based in Scotland, and all going well, should be looking at CCT sometime end of April.
Great. So share with us your journey while you were preparing for the new SCA exam.
It's a new exam. I really didn't have a schema or a plan of how to approach it. There certainly was a lot of talk. There was a lot of information on the RCGP website, but not really, I remember feeling a little bit lost because you heard that it's not the it's not the CSA and definitely not the RCA. There was a lot of question marks. And I was a little bit frustrated because I didn't really know what to do. And so that I found that very challenging in the beginning, where to start. And also, if you are dedicating time to some kind of preparation, is it the best use of your time? Are you actually getting something out of it are you being productive in utilizing that time?
So it sounds like uncertainty was a major issue because this was a new exam and you were not sure what to do. So what did you do after you thought about sitting the exam then?
So the first few days I really didn't have a plan. Formed a group early on, sometime end of July, because I was desperate to just start practicing like most people do. But I came across a lot of information about the new format, so the SCA, and came across a video on YouTube about yourself. And you kind of said, to get in touch. And I remember sending you an email just to have an initial chat about it, because nobody was offering something, where I could talk to somebody about how to approach this exam. So I thought, you know what, I'm not going to lose anything. Let's just see, how it goes.
So you got in touch and tell me about the challenges, as in your mind, there were a lot of things going on as well, I remember at the time.
So personally, I think, most people, we know our weaknesses, we know our gaps. I was aware I didn't have a systematic approach. Actually, I didn't have any approach at all in my head. And people just kept talking about practicing cases. But I felt that, I could practice a case and you'd still give me the same topic the next day or the week after, and I might still not nail it. So I was struggling in terms of, what do I actually need to do? And there was a big talk about, it all being based on your portfolio. You had to focus on the clinical experience groups, look at your capabilities and that. But it was still quite, it was as clear as mud to me because I couldn't still understand how do I go about it. That was a big obstacle, actually.
Right. So the fear of unknown is a common one among trainees. And what did you do in your preparation to overcome this obstacle?
That's a good question. I knew my weaknesses. I knew that you are expected to know your guidelines. I have to be clear about that. The exam is set at you having the knowledge at your fingertips and how you're actually now putting it into practice in an individualized setting when you're actually talking to an actual person in front of you. So I knew that I had to hone down clinical management for a lot of things. And I did have, we've all been taking histories for a while, so we know the kind of, approach you use. But I wasn't sure, because when I was practicing, and it was very haphazard practice in, July time, the exam is like 4 months away. It's still not sinking in what you have to do. And so the practice was a little bit sort of hit and miss. But I think when I spoke to you, and the blueprint that you have is actually free, so anybody can download that. I mean, I looked at the blueprint, and I'm quite a visual learner, so I really liked how, you'd put pictures and images, and you'd really sort of given a little bit of a sort of an agenda to follow for preparation. I found that useful. But then actually speaking to you, sometime, I think it was August, that we had that first initial call, and you asking me, well, what am I doing? Do I know what to do, etc. I was completely unprepared for that. So that sort of gave me a little bit of focus on, maybe I need to be thinking about domains. Maybe I need to be thinking about, how am I going to be assessed? Maybe I need to be thinking a little bit about, well, what the examiner is wanting out of this type of thing. So it started to put things into perspective a little.
Yeah, so there is a lot of information on the exam, but at the same time, there's a lot of confusion, and GP trainees can get different type of advice. So having a clear plan was really part missing, because you were doing things haphazard from what you're saying. Then what happened after you started using a clear structure? What did you put in place to get a better preparation, Yoginee?
So I remember the advice that you gave was, start to be thinking in terms of domains. And if there's something that you're not hitting, for example, for me, it was clinical management. So I don't have to achieve, when I was practicing in my group, it was a very focused approach. But then when I was seeing patients on a day-to-day basis, I wasn't really using that as practice. And I think when you said, try and at least, every patient consultation that you're having, think about one particular domain and just try and get better at that domain, try and nail it. For example, if clinical management is your weakness, identify the issues from your data gathering. And also don't forget the psychosocial, because bringing that forms part of your clinical management in terms of how, and things that you mentioned, to be very honest, towards the end, it started falling in place. I mean, the whole active listening. And I'm sure a lot can identify with, yes, the patient is giving you information, but in your head, you're already thinking 100 miles an hour, like what I'm going to ask next. But actually, that's a little bit counterproductive, because you've then missed what the person has said, and you might be asking the same thing again, which doesn't really go down very well.
Yeah, you hit the nail on the head. It's all good to practice and thinking about what you're going to do. But then on the day of the exam, when you have so much pressure and stress, then everything goes out of the window if you haven't embedded the practice. So it sounds to me that you managed to use your clinics where you're practicing and refining your consultation, and that helped you in your preparation. So tell me more about what happened afterwards.
So afterwards, we then started having one-to-one sessions. And I remember bringing in what I have tried to implement with the patient. So, for example, if I saw a patient with something very simple, for example, a cough, okay, the clinical management may not be, most people will pass that without problems. But, the psychosocial, then try and nail that down. So I think I was trying to do too much at once, and because when you're seeing patients, they're not role players. So, they haven't got a script, because the exam, there is a script. So the patients, they're not role players. So I started to do, separate things. So for example, a condition that, okay, I don't really know what symptoms to ask, or, for example, it's a little bit of a vague thing. So I might then focus on, okay, data gathering type of thing. And I think when we are working or we're seeing patients at the surgery, it's okay not to know or not to have all the answers straight away. And how you deal with that. You can say, well, I'll put you for a phone call. Let me have a look at this, and I'll give you a call next week, and we can, touch base about where we go, that kind of thing. So that kind of helped me identify gaps in, my weaknesses and what I had to focus on. I knew pediatrics is a sort of something where I'm a little bit weak, because I haven't had a rotation in pediatrics. So that was something that I looked at first then. And also, it is a new exam. I think as a first cohort, we had you could say, we were lucky in the sense that they'd already said, okay, we were not going to have a young, child to see, but you will probably be a patient consulting on behalf of a child. So I suppose that was useful in the sense that, okay, you knew that you were not going to be having a 10-year-old child or a 13, 15-year-old child on their own. But it still meant whatever you're seeing, try and find out what you could learn from that for the exam.
Yeah. So tell us about how did you manage your anxiety, Yogini? I remember one of the things you said to me was, I get a bit anxious and sometimes I forget things, which is very common among trainees. What did you do? What were the strategies you use?
Yeah, that's I found that very, very difficult, because the not knowing and forgetting. And I think the more you think about it, you get into the anxiety vicious circle. So even if things you would have remembered, unfortunately, you kind of dig a hole for yourself. And I started practicing with my group. We did, so I knew there were systems that I was weak at. So, 1 week we would practice on sort of a system-based cases. For example, we would do a gastro case, or we would do, a mental health case. But then the next week, we would practice something completely out of the blue. So that helped really hone down the listening, because you don't know what the case is going to be on. All you have to do is listen and try and get information from that. And again, they were a little bit hit and miss. But I think, especially, you remember the 2 days we had the whole webinar where you were coaching us, because you'd always start with the whole explaining about the active listening, and not just picking up the clues, but acknowledging it and remembering that the first line of clinical management is actually readdressing your eyes. Because if you haven't done that, the person still goes away thinking, oh, well, I really haven't had this question answered. So I needed to, like you said, yes, clinical management was a big problem for me, but actually little things that you can add into clinical management that makes a difference, readdressing the eyes, bringing in the psychosocial, telling, the safety netting. And even if you didn't have time for safety netting, as part of your management, I used to say, I will tell you what are the things you need to look out for, which means you need to get in touch with me sooner, although I've arranged for you to come back in a few weeks, type of thing. So again, these were all little things that we don't think, but it does make up your clinical management. And they're easy to start getting the hang of, and so that it kind of just starts flowing, if you know what I mean.
Yeah, so you mentioned that things started to fall into place after a while. So in the beginning, when you're doing things, it might come across as a bit awkward because you're not used to doing it. And then as you're doing it, it becomes a habit. And then things fall into place. And then during the exam, it comes more naturally. Tell us about the exam then. When you sat the exam, what were the things that you found really a struggle when you sat it?
So I was the afternoon cohort of the 14th of November, and that was the day that was particularly hit with the whole IT outage. And I had glitches as well, but I think because we didn't know, I logged in a good 55 minutes before, Even on the day, I had some water in a bottle, I had some snacks, I had some nuts, and I had an energy bar, because I knew that I was not going to leave the room for the 10 minutes break. You log on, and before the exam day, you get sent all links and things to run your system and etc. You log on. The invigilator came in and she said she will come back to me because she's got to do the 360 checks for people before me. But after your 360 check, and they also check your ID, so you have to take some form of ID. There was at least 3/4 of an hour of just waiting around. And during the waiting around, I had my whiteboard, and I used to write on my whiteboard. So I would write ICE, and then I would write I had a little acronym for, I used to call it WASH roads, and I had work, alcohol, social, home. I put safeguarding, and I would put a question mark around driving, because these were the sorts of things that, I easily missed with my practice. So I had kind of realized, okay, these are the things that slip me down. So just put them there just in case. I might not need them, but just to be on the safe side. That was the exam day. I had glitches, but I didn't know what to do because you get 3 minutes reading time. For the cases that I didn't have to read information, I will say the 3 minutes is very important, because they've given you a little bit of a gist, and you can start to think about, okay, they've given me this. Okay, why have they given me renal function? Why have they given me, this kind of blood? Why have they given me a cholesterol level? So, it might be something to do is just to be aware of the information. And although I wouldn't write the actual numbers, I would just write, if they've given me blood pressure, I would write blood pressure, renal function, cholesterol, just so I know, okay, you've had this done, just to bring that information into context. I have to say there are some stations where you have 2 pages of information to read. And every station that had 2 pages to read, for some reason, I wouldn't get my 3 minutes. The clock would be like, 1 minute, 19 seconds. And I'm like, do I tell the invigilator, or do I just try and do the best that I can with the 1 minute, 20 seconds or 2 minute, 10 seconds, something like that? So that was the exam day. Also, after the exam, you still had to wait because you couldn't go anywhere. The invigilator had to come and say, okay, you can now log off. They asked me if I had any problems. I said I just had a few glitches, and they asked me if I think that had impacted my performance. I think I was far too relieved that it was over, and I couldn't think of anything else to say. And I said, no, I don't think so. I didn't have to rerun any stations because I couldn't actually remember which number stations did I actually have those glitches, because I was just like, I'm just going to have to work with what I have on the day. One thing I will say though, the SCA Companion was very helpful, because the day before the exam, you're so stressed that you can't do anything. You don't want to practice anymore. But what I did was, every case that we practiced in the group, I used to write down, used to have a column on an A4 page, and I would say, what I did well, what I didn't do well, and what were the learning points. So if I had to go and refresh a guideline, then I would go and refresh the guideline and write the main points, on the back. So on the eve of the exam, all I did was just go through all of these cases, and I looked at what I had missed. For example, if it was a case on, say, a women's health topic, used to forget asking about smear or something of the sort. So I just went through that because I couldn't bring myself to do anything else, or practice any more case. So I thought, you know what, I'll just look at these things.
I'm glad you mentioned the SCA Companion. So many times I've seen GP trainees, they're just doing practice sessions, but they don't have any intention, they don't keep a track of the cases, they have done, and let alone the learning and the feedback. So when you had that, it sounded to me that it saved you a lot of time, and it also gave you some peace because you knew exactly what you practiced and the learnings. And it's a good way of accelerating your learning towards the closer time to the exam. So tell us any other strategies that you found helpful, Yogini.
I'm very grateful for the group that I practiced with. I had 2 study groups. And then about a few weeks before the exam, because I'd attended some of the, the full day practices that you'd organize, there were a couple of people from the group that contacted me. And I was just more than happy to have many people to practice with. But I have to say that there are so many days that I didn't want to practice because you are exhausted, you're tired, you can't think. But my group kept me going. We've initially started with 4 people, and then there was one person who decided they wouldn't be doing the exam in November, and then they left the group, and we were left with people who are going to do the exam in November. I think it gives you a different kind of bonding if you are doing the exam at the same time. And there are days that I have not felt like practicing, but then I had my group mate texting me or calling me saying, no, let's just do at least one. Let's just do at least one each. So I think it's really important to have that.
Yeah, I think having somebody who is keeping you accountable really helps, especially when it's tough or during period where you don't want to do anything. So tell us about your practice and your tutorial. How did you utilize these for your exam preparation?
I think I thought initially that I need to have a sort of a systematic approach, like presenting complaint, history of presenting complaint, get your red flags out, etc., etc. But then towards the last few weeks, I realized, and maybe it comes with practice, because the more you practice, it gives you confidence. You feel that, okay, I have my strategy, I have my plan in my head now. Maybe I can relax and just listen to what the person is saying. And one of the things that I still remember, and I did take that to me on the day of the exam, was, you'd mentioned, imagine that patient being your mum. And how would you speak to, if your mom is coming to see you with this kind of problem, how would you deal with that? Or how would you have wanted your family member to be treated? How would you have wanted their interaction to go? I think once you put yourself in the shoes of the person, even though it's a very unreasonable, or you can't understand where this request or query is coming from, it does make you start to have some kind of empathy. And even if you don't know, you can say, sure, I would like to know a little bit more about where that's coming from. Can you tell me how it all started? I mean, even that just, and it just allows the role player to say everything that they want to say. Then all you need to do is just ask a few specifics. Because I think in the beginning, I was all about, myself needing to ask, 10,000 questions. But actually, when I realized that in the first 2 minutes, because you had that schema, in the first 2 minutes, let them talk, get the ice out, because that means you've got the crunch of where to go from here.
Yeah, when you get the ice early, it saves you a lot of time. You understand what this case is about, and then you have a better grip of the case. So tell us about your thought process, as in why you were preparing it, whether you had any doubts at all.
I had lots of doubts, plenty of doubts, because we didn't have anything to pick up on from previous group. There's always the uncertainty of being the first cohort. So I had a lot of doubt about how it was going to go on the day. We looked at the whole IT thing, and we didn't have a sound. When they sent us the link to kind of see how things were, you could just see the person in front of you. You had like the replica of the sheet of information, but you couldn't actually hear anything. So I did have my doubts, but because we'd run the test. I had a dedicated room. My supervisor was very supportive. She looked at all the instructions about the preparing of the room. I was given the last room of the corridor, which was supposed to be the quietest room with the least distraction. And I'd gone ahead and bought myself one of those, not the Wi-Fi, but the plug-in, the plugins.
The headset?
Not getting the word. Headset. Yeah, the plug-in headset, and it had a microphone in it, and I think that definitely helped. So I tried as much as possible to eliminate the doubts, but the most important, I think, is cultivating a sense of belief in yourself, and that comes from talking to people. I had you coaching me, and you're aware of a lot of the personal issues that I was having at that time, and even questioning if actually I should be doing the exam in November, or because I'll be CCTing sometime in April, shall I just go for January or February? And my mum was a very, very big support, even though she, is many, many miles away. I speak to her 2 or 3 times a day. So I think doubts are going to be there, but you have to have a strategy of dealing with them. Do everything that you can that gives you confidence. So practice. And, the coaching program that you had, I looked at the videos not just once or twice. I looked at them at least 4 or 5 times. And every time you're looking at them, you're kind of learning something different. For example, you know what you have to ask, but then that may not be the appropriate thing to ask given what the role player has just said.
So yeah, that's really important, because there's a sequence in when you ask a question and when it's a good time to ask something else. So that's something where sometimes people may ask question out of context. But it sounds to me that you had a better understanding when you observe other case selections that we had on the program, and then you implement that in your own practice. Just out of curiosity, did you do any recording, Yoginee?
I did very few recordings. With everything that happened to me around March, April time, I had started some recording and then I just gave it up because I knew that the issues I was facing, this was not going to work. And my supervisor was supportive of me to actually do the new SCA exam. She wasn't, not that she discouraged me. She said that she found that trainees who've done the RCA before, the whole recording becomes such an overwhelming thing that it takes over the whole ST3 year, doesn't give them, a flair for what ST3 year is, and just is so cumbersome.
Yeah, I've gone through this recording and it takes a lot of time and energy. I think most of my tutorials were in these RCA recording. So tell us, if you had to speak with yourself at the time while you were preparing, with everything you know now, what would you have said to yourself then?
Believe in yourself and listen. Just listen to what the person is saying, because sometimes they are actually giving you information that is important or useful to you in your clinical management, and let them talk. Just let them talk. If they've given you lots of information, just acknowledge that. And it's just, don't, we worry about getting everything out in 6 minutes, and sometimes you can't. I mean, I still recall I had 3 cases out of my 12 on the exam day that I have absolutely no clue. Absolutely no clue what to do, what's going on, because we are so diagnosis focused. We are so pathology, treatment focused that, we fail to listen to what the person is saying. And a lot of these cases, there was nothing medical. It was either an ethical thing, or it was a situation that the person was just wanting to share, and they were just wanting to explore, what support was available. So there's no tablet, there's no medication, there's no side effect to talk about. So it's about going with an open mind.
Yeah, that's really important, because we've got this doctor's hat all the time. We're just thinking about the biomedical, the disease. Sometimes it really helps to take a step back, take the doctor's hat off, put the patient's hat, and see things from the perspective of the patient. And it just unlock different path, and you find that the consultation goes better because you actually solving the problem that the patient is coming with rather than just pushing the doctor's agenda.
Yeah. And sometimes if you are suspecting something, you've acknowledged what the person has said from their eyes and everything. And you know, it doesn't hurt to say from all of what you're saying, I've got a thought about potentially this. Have you come across this? Have you heard of this? Has anyone mentioned this to you? It's very interesting how hidden agendas also come out, because sometimes they won't give you everything, but if something is very obvious that, you know, in this case you need to be thinking of this, but they're actually worried about that, it's all about, you know, how you bring that in, but also acknowledging that, because, you know, patients think, you know, something that definitely is unlikely to have a link with the symptoms, but they are telling you, but, you know, I think it's because of this and this that I've got this, and you know full well there's absolutely no link. But how do you do that, you know, in a manner that doesn't offend the patient?
Yeah, you need to be able to discuss and show that you understand where they're coming from, and that way they will see that you're on the same side as them. So tell us about your journey. Like you had the exam and then you had to wait, and then what happened afterwards when the result day was out?
I honestly, I couldn't believe it. I couldn't believe it because I knew there were so many stations. I mean, I remember the three that I had absolutely no clue. And then it's like you start having brain fog. And I was thinking, did I actually introduce myself in all my stations? Did I say who I was? And, you know, you start doubting everything. And then, you know, after after the exam, we used to get an email, at least one email every day from the RCGP, because, you know, it's been really unfortunate for a lot of my colleagues on that afternoon cohort, because it wasn't, you know, it was not their fault at all. It was just a system crash. But, you know, interestingly, the day the result came out, it all came back again. And I was in a lot of groups and I could see what people were talking about. And, you know, I could tell what actually, you know, the buttons and the things and what they clicked that actually made the system crash. And I think also because I'm not very, very friendly with IT, I just didn't touch anything on the day. I was just like, it's working. I don't want to jinx it. But the day the results came out, coming back to your question, I was very grateful for everybody, especially my mum. You know, the coaching that you provided, a lot of the information that you had signposted. I was very, very, very grateful for that.
Well, I'm really glad that despite all the challenges that you've had, and some of them you're still going through right now, you managed to pass, and now you don't ever have to worry about this exam. So, if somebody has been listening up until now and they are preparing for this exam, what last piece of advice would you have for that person, Yogini?
Believe in yourself, trust yourself, and practice your cases with a purpose. So if you're practicing a case, if you know that you're going to do a case, I don't know, maybe a cardiac case, practice it with a purpose. For example, I didn't have much knowledge about, you know, metabolic syndrome, cardiometabolic, you know, all of that. So, and also after doing a case, there's always a purpose. So I can only talk about what worked for me. Writing it down, using that SCA Companion was really helpful for me, because, you know, it was there on paper what I didn't get when I did this case, and it was there on paper the CKS that I needed to go and refresh. Most of them were mostly management. So I would just put a few bullet points on the management of, say, ADHD, you know, that kind of thing. But please, I would definitely say you have to believe in yourself. If you have to look in the mirror and talk and introduce yourself, do that. And smile, unless you know from the information that you've given, somebody is going to come and talk about low mood and that kind of thing. But the belief in yourself is really important, and doing everything that brings you that belief, including the coaching.
Great. I think we've touched on a lot of really important part on the preparation. The coaching help you if you've got somebody who is thinking about the coaching, might not be 100% or sitting on the fence. What would you say to that person?
I would say definitely go for it, because you cannot underestimate the power and the usefulness of individual feedback and practicing with actual actors. You know, our colleagues they may be soft on us. They may not like giving you, strict feedback. I would definitely recommend going for the coaching. But if you're going for the coaching, I would say try and do it at least 2 months before the exam, because there is a lot of information to gain from the coaching, and you don't want to, leave it last minute. Like for me, I went about 3 months before the coaching, and I felt that it gave me ample time not to look at the videos just once, but a few times. And sort of, I have to say, some of the videos were very, very helpful because I had similar scenarios. So that was important. Give yourself the time to learn from the actual coaching program.
Well, thank you very much for your insight. And if you're interested to get help, then I'll leave a link down the description below. You can get in touch and we'll see whether there's anything I can do to help you. So just to let you know, in this interview, we discuss various parts of the consultation and the preparation. And there's much more insight that you can get from the blueprint that is free, which is what you're going to use initially. You can get it down in the link as well. Thank you very much for your insight. What are you looking forward now, Yoginee?
So now at the moment, I have all of my portfolio work to get out of the way, because I have my ARCP in about 6 weeks. For the personal issues that I had taken time off, I'm expecting some form of extension, but hopefully it shouldn't be more than 3.5 weeks, maximum a month. So hoping to CCT and just look at, what life has got to offer afterwards.
Great. Thank you very much. I'm really glad that to see you on the other side, and I'm sure that things will get better post CCT. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.